This is part 2 of my in-service on exercise and dementia, and continuing this study on Tai Chi exercise and fall risk in patients with dementia out of Michigan. So with this study, what they did was they had patients with dementia and their caregiver, and they paired them up, and they taught them how to do sticky hands Tai Chi, which maintained contact the whole time. And that's the way for dementia patients to learn Tai Chi, because they sort of have a guide who's moving their body at the same time. Their inclusion criteria was over 60, so a little bit than the last two studies. And they had to have a mini mental state exam of 26 or less. Remember, the top high score on the mini mental state exam is a possible 30. So 26 or less is a huge range. And they had to be able to take one step without an assistive device. 22 completed the 4-week group training course. 19 completed the 16-week assessment, and they measured timed up and go, the unilateral stance time, and the mini mental state exam. And the patient and their caregiver both together went to 60-minute group sessions 2 times a week. And then after 2 weeks, they started a transition to home exercise. They still continued to do a couple group sessions, but eventually it became more and more home exercise. Findings. Continuation of sessions at home was relatively successful. That's really cool, really good news, I think. And there were no adverse effects, falls, or injuries from the Tai Chi. That's also really cool, I think. Timed up and go average decreased 2.2 seconds. That's really significant. The unilateral stance time average increased 1.3 seconds. Also good news. Improvements continued for mild impairment patients. And that's after the transition to the home exercise. So for the patients who are mildly impaired, they continue to improve with the home exercises. But for patients with moderate to severe impairments, they stopped improving after the transition to home exercise. So the severely impaired patients really seem to benefit from the group session. It's really interesting. But nevertheless, the fact that the TUG and UST scores decreased, the fact that there were no injuries, the fact that they kept at it, the continuation of sessions, I think this is all very optimistic once again. There's room for hope if you're working with patients with dementia. Strengths and weaknesses of this study that had a relatively good adherence rate. New possibilities like Tai Chi, and this new Tai Chi method that they're doing, the sticky hands method with the caregiver. Multisensory treatment method, they had music, there was verbal cues, the fact that they're getting the sensor, proprioception of Tai Chi together with the sensory guiding of the caregiver that the caregiver is providing. Weaknesses are that it's a pilot study. They did say that they wanted to do a longer follow-up study. That has not been published yet. I don't know if they are doing it or not. Perfect. Canceled. There was no control group, and a lot of commitment needed by the caregiver. Conclusions from all these studies: functional and resistance exercise can contribute to small improvements in gait speed. But